Hello, friends, and welcome back to the episode. So, here in just a few minutes, I know I say this all the time, but I am so excited because I am welcoming another guest. Michelle is a student of mine, and I think she has a really great story that you guys are going to appreciate. She really is somebody who I say is my Lola because, I talk and I preach about this. But Michelle was somebody who came to me. She was already trained, but she had what we like to call the gap between knowing and going. She knew where she wanted to go. She wants to have a life first business. She wants to build a life she's bonkers about. But what she found after the training that she took is she didn't have what it was going to take to get there. So the reason that I say she is my Lola is because she is not afraid at all to make the investment in herself, make the investment to get the skills that she needs to get what she wants. She came to me, she was already trained. She was not afraid to invest in at the time, the Ditch Hygiene Academy, which was, $8,000-9,000 investment. And then once she got into the program, then she realized, hey, I can either invest time or I can invest money. So I'm going to invest money. And then she upgraded into the Done For You program so that she could have a lot of the stuff set up for her. The branding, we set up her software, we trained in all the software, the scheduling, we get all of that stuff integrated. So because she was working full time, she knew that that was the route she wanted to go. So I know I talk a lot about your ideal customer, making sure that your messaging is right for that person. She is my Lola because she is the exact person that we market towards. Not afraid to invest in herself. She does the work. Like you give her, things to work on, or like most recently, I gave her website critique. And you guys, when I do a website critique, I don't just go take a look at somebody's website and say, oh, hey, it looks nice. You get a very comprehensive website report. So we will see if we can put an example of that in here where you're watching it. So you can see the kind of report that I put out for my clients so that they have a checklist. So that's the thing that Michelle has been working through is just taking each of those line items and fixing them. So that is it. I'm going to let Michelle introduce herself. We're going to talk about her interesting journey or her experience in both. She's building a business for herself, but she also is doing it in the office. And you guys know how I feel about that. So we're going to learn from some of the stuff that Michelle has been learning. And without any further ado, let's jump into that interview. All right, you guys. So before I give Michelle the honors of getting to tell us how she found Myo, all of those things, how she got introduced, Michelle, I have to start out with this because I was just telling you before I hit record, I was just out hiking with my dogs and I was thinking about you finding me coming into this program. And also because you and I were just doing coaching this morning and we were talking about that ICP, the ideal customer persona, ideal customer avatar. And I have to tell you, you are our Lola. Do you know that?
I kind of feel like the Lola, which
You are.
is,
Yeah. Yes. Because, I think about, and I was thinking about this while I was hiking, how you came to me. You were already trained, but stuck. And so you had what we call the gap between knowing and going. So you knew exactly where you wanted to go. You wanted to build this business. You wanted to, build a life you're bonkers about, have that life first business, something that you could control. But between your training and where you wanted to go, so what you knew and where you wanted to go, there was that gap. So that's how you came into my world. You weren't, the reason I say you are just so much my Lola is because you were not afraid to invest in yourself and get more training that was going to help you where you needed to go. And then even on top of that, so by that you jumped into the Ditch Hygiene Academy, but then also you jumped into the Done For You program. So you invested thousands to get in, and then you invested thousands more to, the whole, you can invest time or money to have somebody do it for you so you could get going faster. So it just all of a sudden dawned on me, and I thought, she is my Lola. She is. So, with that said, I am so honored to be able to get to have this opportunity because we're going to have a conversation that I think is so important. And there's probably a lot of women out there listening to this podcast that nod along or maybe are in the same situation. So before we get into the juiciness, tell me where you're at, how you got into Myo, all the things. And then we'll talk about what your business situation is.
So first of all, thank you, Carmen, for having me. Yes, I am your Lola. I felt like at one point I was your stalker before I committed, but
My stalker.
oh yeah, I was like devouring all of your free content online because it just connected with me, your voice, what I thought things should be, where they should be going for me. It just clicked. And so I kept fueling and eating up all of your free content. And then I said to my husband, oh my gosh, I have to do this. This only makes sense. So I'm a dental hygienist, of course, by trade, for over 30 years. And I was chairside hygiene, going strong, feeling the pain, feeling the aches, the shoulder, the back, the neck, knowing that I couldn't sustain this long term. It's just not feasible. And I was working a full time, sometimes 2 12-hour shifts in a week schedule, and making great money, loving my service with the patients and the patient connection, but knowing I couldn't do this for long. So I started looking years ago of ways to get out of hygiene. Well, what else can you do? And I happen to work in a practice where it is production based. There's adjunct services. It's a great practice if you're a hygienist because they really do allow you to be the person that is having the big conversations with the patients. It's not the dentist is telling you, you clean teeth, I come in and do the exam and say everything. This is a practice that is built and meant for you to grow and learn. And I had learned so much. I grew. I transitioned from chairside to training to department manager to, I just kind of went up in their corporate ladder, and I was enjoying it, but I just didn't want to do these chairside hours. So figured, well, what can I do? Well, I can develop and support hygiene teams. So I started my own business and did this. I'm going to do this whole consulting and started to move towards that. And then COVID hit. And then nobody was doing any consulting. So
Because
that
nobody,
went
there was no
nowhere. Yeah.
hygiene.
There
Yeah.
was no hygiene. And even afterwards, nobody's going into any offices. It took so much longer
Mhm.
afterwards to, start where people are actually coming into the offices. So I was like, so that never really went anywhere. And you know what? It's wasn't meant to be because I hate math, and a lot of that is math and numbers and statistics, and that's not my forte. I can support a team, I can train a team, but so then I had what I call my divine intervention. Um,
I love it.
this was not something that I was expecting, but I had a breast cancer diagnosis, and
Oh,
that's that one that stopped me dead in my
the
tracks.
tracks.
I could no longer practice hygiene. I was immediately told I need to stop working, stop doing everything, and get right into treatment. And, being that hygiene is our number one high risk exposure, I couldn't be chairside. I literally had to take years and years of seeing patients and just stop what I'm doing and figure the rest of my path out and figure out what was to come after that. Like when I was going through treatment, I just had to get through treatment. But as I was coming out of treatment, it's like, oh my gosh, I can't practice hygiene like I used to. It was hurting me then. And now I've had 3 surgeries. I've
Mhm.
gone through a lot. My body is different. I had to go through months and months of physical therapy just to be able to have a full reach above my head, which I can now. But that was my whole career. It's like, what do you do then? So at the same
Wow.
time, yeah, it's like, what do you do with that? I don't want to work at a desk. I don't want to, check out patients. And then you're talking about a salary level or an earning potential level where I went from here to, well, what now? Who was
Right.
planning for something like that?
Hmm.
So at the same time, I really was blessed because the owner of our practice, he has been practicing dental sleep medicine for years. And he was retiring from general dentistry and stepping us away from chairside care and only focusing on sleep medicine. But up until then, it had been like this little side gig in between his dental patients. Oh, yeah, yeah, I can do that for you. But it was never really developed, never really grown. And he felt it had a lot of potential. And he said, hey, do you want to do this with me? And I said, yeah, sure. It kept me doing my face to face patient care, the service that I love with hygiene. So I wasn't missing that. I had the connection. And it helped me get through all of the hardship with the therapy. I had a focus, I had a distraction, and we ended up building the practice to as much as we could together. In the course of my journey, as I'm learning more and more about sleep medicine and anatomy and taking all of these courses, symposiums, going to all of these different classes, I remember sitting at a symposium where it was all dentists learning dental sleep medicine or trying to enhance their dental sleep medicine practice. And we were sitting at a table at lunch, and I'm surrounded by dentists. And the person next to me asked, "Well, what do you do?" I said, "Well, I'm a hygienist, and I am directing his department for dental sleep medicine right now." And she, explained I'm a hygienist, and she said, "You really should look into myofunctional therapy. We need myofunctional therapists. There's not enough of them out there." And I kind of knew what myofunctional therapy was, but my connection in my head had to do with orthodontics because the orthodontist in our practice would refer out to a myofunctional therapist. I just didn't know the details. So I started looking into it, going online, taking free webinars, getting the information, and I realized, oh my gosh, yeah, this is connected. This makes sense. And so I finally decided to take a course, a training, and I did my training and I learned all about myofunctional therapy. It opened my eyes and it was like, wow, this is what I need to be doing. And that's where the divine intervention,
This is the part
I
I love, not the
I
other part.
knew I knew this hygiene wasn't working for me before my health issues. And I was led along the path to where I am now. And it felt like this is where I was meant to be. And it just, I took it from there. I took the courses, I'm devouring the material. I'm like, this is it. This all makes sense. Now I'm going to bring this back into our sleep medicine practice and connect the dots for all of these people. It's, up until then, we were doing the sleep appliances, doing the sleep studies, but it was literally just treating while you're sleeping. Here's your airway, safe and open. What about everything else? Wasn't changing anything. It was like putting on a band-aid on something. And I didn't know that. I didn't know that. They don't teach you these things in hygiene school. They don't teach you these things in dental school. So I had all of my education. I went in there, guns blazing. I'm like, I'm going to really make a huge difference in this department. We're going to bring on all these fantastic services. We have all the minor components. We have the orthodontist. We have a pediatric dentist. We are looking at these things, but we're looking at them in separate sections in our office. The pediatric dentist is talking about growth and development and eruption of teeth and things like that. The orthodontist is doing expansion and development, but nobody's talking about the airway. And then the sleep medicine doctor is doing sleep appliances, but nobody's talking about no tongue rest space, no airway space. What are the root causes? So here I am coming in going, that's it. I have the answer to everything. And I did, but I didn't because I didn't know where to take this information. Nobody gave it to me, wrapped in a box, and said, all right, you have the knowledge. Here, this is how you implement it. I
So
didn't
that
know.
was the key. So you had the clinical knowledge from your first
Yes,
program. Um, you just didn't know what to do with that. You didn't know how to implement it and where to take it from there, right?
exactly. And again, going online, trying to get more, I came across you. And that was it.
Divine intervention number two.
It was like, oh my gosh, this is the one. She's my person. I feel the connection. What she's saying, she's like the voice in my head, but now I know where to go with this. And dabbled first. I wanted to do just the ditch hygiene part of the program. But as I looked at it, I was like, this is basically repeating what I just did. I really need to know where to take this information. Where are the exercises? Those weren't shown to me. Those weren't taught to me. It was just basic information. It was, oh, maybe you can take a little bit of basic lingual skills and mix in some functional.
Wait,
I,
I don't mean to interrupt you, but you were clinically trained and did not know the exercises. You did not
no,
have an
I
exercise library.
I had a limited exercise library that was focused on working on the basic lingual skills, but it wasn't to the level of how elaborate your program offers, where I have a reference point. I have sessions. I didn't even know how many sessions, what was the intervals between sessions. I didn't
Gotcha.
know.
Your plan. So you didn't have a plan.
I had no
And the
plan.
exercise library. So I bet when you got into the exercise library, you were like, I better have a seat here because there's a lot. And like I tell you guys in the program, you won't use all of them.
Yes.
I have taken everything I've learned from everybody and put it in there just in case you need it, but you're not going to need it. But that's crazy. You can't be
Yeah.
clinically trained. And I know that's not what we're here to talk about. You can't be clinically trained if you don't that's what you
Yeah.
teach is exercises. So okay,
It-
go ahead.
yeah. I mean, I had some exercises,
Yeah.
but how to put them together, I don't know. I wasn't sure of it. And it's not like we're not knowledgeable. As hygienists, we're knowledgeable, but as hygienists, you're also like perfectionists. Like you're going to do it. You got to do it right. If you can't do it right, you're not going to do it,
Yeah.
and
Right. Yeah.
that's, I think a lot of us struggle with this. But, once I said to my husband, I was like, look, I really need to level up with this program. I think this offers exactly what it is that I'm lacking. And I'm tired of waiting for permission to proceed in a dental office or a dental practice that wasn't ready for it. That's basically what was going on. I was waiting for permission to proceed, where I have the training and I don't have the same restrictions that dental hygiene has. Like, you're a myofunctional therapist, go and do it. And you were the one that was like, all right, get up and go. Here are the exercises, and now you got to get it going. So that's how it all came together for me. And here I am. So I just kept beating my drum because I'm still working with sleep patients in the office. I
Mhm.
couldn't unsee what I saw once I have that knowledge and training. You can't unsee it. So now I was having the conversations, but I didn't have any sort of resolution to offer them because they didn't bring the myofunctional therapy services on board yet. But I kept doing my thing and pushing, and then eventually I decided, I'm doing this for me. I'm doing this on my own. This is what I was looking for. I wanted my own business. So I did my investment. And, when you say, oh, you don't have the money, this was something like, yeah, you really do have the money. You just have to decide where you're going to pull it and if it's worth your investment. And it totally was.
If you
Um,
are worth the invest, if you
yeah.
are worth investing in yourself, because that's a
Uh,
biggie, right?
yeah, absolutely. And so, I spoke with my husband. My husband's like, you know what you're doing, do it. And I did, and I haven't regretted it, because the moment I got into the Ditch Hygiene Academy, and I had, like, I can click and know, and here's my therapy templates, here's my sessions,
You're
and
giving me goosebumps.
what does that exercise look like? Oh, there's a video for that. It was like, oh, hallelujah. So, at that same time, the office was going through transitions, and they had brought in a consultant. And the consultant was really to work with the insurance and how things are working in the office with the way we're talking about insurance and people's understanding of what they have. And, she was interviewing all of the leadership's department directors, and she sat with me and she goes, "You're a myofunctional therapist?" I said, "Yes, I am." She goes, "You're a specialist. Are you practicing?" I said, "No, I'm not. I'm not in this practice. I'm trying to build that here and for myself." And then all of a sudden it became, Michelle's a specialist, and she really has a lot to offer. And at the same time that I committed to myself to do my own business, all of a sudden the light bulb went on in the office, and they were like, "Oh my gosh, yeah, we're going to be doing this here too." So now I was doing it on
You're
two
juggling.
levels,
Yeah.
and I wasn't anticipating that. So it's not that it was a bad thing. It was just a lot. And, there were a lot of questions that were unanswered. How do you bring this into a practice? What does that look like? Your guidance is really gearing us to do this for ourselves and for our own business, because that's what's going to make the most sense. And I'm 100% for that. But I was already pushing this. So I was like, all right, I'll roll with this and let this be my learning. And, I will eventually get better at what I'm doing. And it's only going to help me in my personal practice. So that was my thought process. Boy, was I
Boy, were you wrong.
wrong. Boy,
Well,
was I wrong.
yeah. And I mean, at face value, it sounds like an amazing opportunity, right?
Oh, yeah,
To have
absolutely.
to be building your own business, and also now you're being given the opportunity to do it in the office. And it's funny because you say that my biggest leadership is helping you get your own thing. And it's funny because when I recorded the intro to this podcast, I said, like, you guys all know my opinion. I'm happy to support you, and I have supported a lot of students in doing it. I just know how it ends up. There's generally hurt feelings or frustrations or something. I've had students who, I mean, I've had somebody on the podcast before, same thing. Her boss died, had a heart attack, and he
Yes.
passed away. Just all of these. I have another student, the office that she wasn't doing it in her employment office. She was a subcontracted, and he did a meeting with her and lowered her percentage. And she was like, wait, and so I think that is a message from the universe to, like, cut bait and go. So yes, I do always try and talk women out of building it in a practice, because you just never know what's going to happen. Somebody was hit by a bus. I know that's terrible. Like, it just there,
Hmm.
you just don't know what's going to happen. Or somebody can bring on an associate that you love, your boss, now the associate you don't love. So there's a lot of situations, but you've been in this office a long time. You saw it as a great opportunity. So how did that play out?
Well, they were very supportive. Once they decided to be on board, it was full speed ahead. Everything. They have a very strong marketing presence. So that was the first thing. I was immediately swept up in developing marketing for them because they didn't know. And then there was the staff didn't know. They're not teaching you this in hygiene school or in dental school. So now I'm building the bridge between the knowledge that the limited knowledge that the hygienists and the dentists have with what is myofunctional therapy, how does this benefit this, and if we're structuring this as an airway health dental office, how are we speaking about that? All the pieces of the puzzle are there, but we have to put it together and connect it for the patients. So now it started out with educating the entire staff. That went from the hygienist to the dentist, front desk staff as well, everybody, and it's a big staff.
Mm-hmm.
So that was the first part of it. I did a lot of educating and, building the excitement and teaching them what to look for, where are the red flags, introducing simple screening systems for the hygienist and the dentist. So it's not taking much of their chairside time to have this conversation. Hey, where are the quick recognitions that you can build on? And that's simple. It's the Ferris 6 screener is the easiest visual. It's 6 questions. You boom, boom, boom. Yes, yes, no, no. And that's it. You have a risk and now you can talk to the patient about that. So that was the first few months. Then the marketing came, and then I'm in this big practice. We are fully in a dental software system. Myofunctional therapy is not really part of the dental software system, so I have to build that, put the coding in there, the templates in there, the treatment planning in there, structure all that. And let's see, then it's talking to the patients. And now it's like, well, what's the services that you're offering that for the patients? Now I have to define that. And it's not the same as defining it for your own business, because in your own business, 6 months, 12 months, if you're doing pediatric, you have the mini myo, you kind of know what you're setting the pace for the patient and bringing the patient in as it's your responsibility to book your appointments. Here in an office setting, you have to quantify that. You have to put a number on that. It can't be it's 6 months. Well, what does the 6 months look like? How many sessions is that? What is the interval of the session? What are the appointment parameters? All of that I
Yeah.
had to build in. And at the same time, I'm doing this for my own, but this seemed to be taking up more and more and more of my time from building mine.
Took your eye off of your prize to work on the other thing.
Yeah, yeah. And believe me, it was still excitement. I'm still like loving the connection and building these blocks for the patients that they are like, wow, oh my gosh, nobody's ever said that to me. Thank you so much. How come nobody has talked about this before? And, it's because I've had this specialty training and now I can see things that I didn't see before.
Yeah.
And so I'm basically over the last few months building framework for a business within their business in their foundation. And, I know you're always saying that's not what's going to benefit you, because look at this last podcast that I heard that the person did this and her boss died and then she had nothing,
Yeah. It's like building
and
that house on rented land. It's just,
yeah.
it's in the moment, you don't think about it. And it just gets tangled from many different ways. Some bosses want to pay for the training, and I'm always like, pay for your own training. Don't let somebody else pay for your training. All of these
Yes.
things, it really comes out of fear. And your situation was not that at all. Like you had this amazing opportunity, and you saw it, and they didn't take it. They weren't biting. So you were like, okay, I'm going to do it for myself, and then they saw it. So that it would, under normal circumstances, I think it would be a great opportunity. But you're running into I won't call them snafus. You're running into
Yes,
learning. You're learning some things.
I
So,
am
what are you
learning.
learning about the two? Or doing
It's
it
a
in your
wonderful
practice?
thing to bring in a service, but when you actually are living the life, it's not all roses and rainbows and butterflies. Like I thought, oh, this is great. I immediately started right now. They probably started mid to late April, and immediately I took on right away 2 12-month comprehensive patients. And it's just each week I'm taking on another one or two, so it's working in the office. But here's my biggest learning moment. So my practice was very, very generous in saying to me, hey, we'll let you, stay directing this airway health department, and then you can do the myofunctional therapy as a side hustle and earn a percentage on top of what you already are earning, and which is a salary because I'm no longer chair side. It's not hourly or anything like that. And it's generous. So I was like, wow, that's amazing. What an amazing opportunity. Great, let's do that. Well, you have to quantify that. What is that going to look like? And that's a big question that a lot of us, when we were going through the training, what's the percentage? What is the average earning that you get in an office? What does that look like? What are the structures of getting paid for that when you're talking about in an office? So for me, it was a percentage of what I'm earning. It wasn't like, I know some hygienists are like, oh, we switch hourly rates or whatever it is. And,
Mhm.
for simplicity, 40% seems very generous. And to keep it, basically, I have a 12-month comprehensive package that's, let's keep it simple, $4,000 at 40%. Okay. So I had two patients take this on. I was so excited. I
Because
was
you're
like,
seeing the dollar. What's 40% of $4,000, right?
$1,600 a case. I'm doing a dance. I'm like, this is fantastic. And then payroll comes around. So,
I don't mean to. I'm not laughing at you. I'm laughing with you. I'm crying on the inside.
well, you know what? And this is me not like really thinking about all these tiny details. In the reality of a big practice, it has to be like my practice. It runs on production collections. The providers earn percentages based on what their agreement was. And I had an agreement drawn up, and that the percentage was on the production, but they like to call it the collections. And really, it's the production. And I'll tell you why. In order for them to run a payroll report as to what my earnings should be, in the computer system, when the visits are completed, so I complete the services, and that posts to the ledger in the system so that they can run a report for me as the provider. What did she earn doing her myofunctional therapy? And then take the percentage off of that. So here's where the disconnect was, which I didn't realize, and it's my fault for this one. Um, those two patients that came in right away, full comprehensive package, $4,000 each. They were all on board. They trusted me. The buy-in was there. They paid upfront, full 12-month comprehensive. They chose to do interest-free financing, which is an option in my office. And that's great. The office gets paid right away. They pay back their financing company, which is an outside provider, on a monthly basis. So it makes it very affordable for them. Fantastic option. Now, as the provider in the practice, there is, for the practice to use a service like that, there is a service fee, and the service fee is similar like the credit card fee,
Yeah.
where in our business you're teaching us, okay, you need to decide if you want to add that 3% credit card fee to the total cost. They do not add the 3%, the percent fee for the service to the patient. They take it from the provider. So in our case, it's 10%. So Basically, they collected the $4,000, and immediately the $4,000 had that 10% fee attached to it. So that was $400 that came off of my potential earnings before I even had a chance to see the patient.
Yeah.
So now I haven't even earned anything and I'm already in the negative 400. And then I started doing the calculation. Well, with my percentage, if I'm earning 40%, how many sessions before I actually start earning after to pay off that 400? It's about 5 to 6 sessions, and
Before you're back on top. And what
before
if the person, and you and I talked about this, what if the person doesn't finish? Because
they've
that
paid up
happens.
front. Yeah, it
They've paid
does
up front.
happen.
Yeah.
They
It
paid up
happens a
front.
lot.
And I have not yet had that lesson. I'm sure that is to come.
Oh,
And
oh,
I
it,
can laugh about this now, but my first production earning, my check, was a big fat zero.
yeah,
It was, I
yeah,
had done like 3 sessions on one, 2 sessions on the other, but with the finance charges, it was in a negative. So it was like, oh, and eventually it will pan out as more patients come into the practice, and I won't feel it as hard as I did. But it was a wake up call, and it was like, wow, ouch. I didn't anticipate that.
yeah,
That was a lot of work. And I felt like it was a big, somebody let the air out of my balloon
for
rather quickly.
sure. Yeah. Well, and the thing is, for anybody who's watching this, me, me and my business brain, and some of these things you and I have already talked about. It is very real. It is very real that people pay. That's why I recommend packages. Because if it's a per session, people flake right and left. And I always give the example, my massage example. If I commit to getting a massage every Friday, that person's going to go bankrupt if they're planning me to pay their bills.
Right.
But so people, I mean, I have had people who pay $5,000 for a year of therapy, and they'll do, some of them get through the tongue tie release and then they're good. I've had people literally do one session and say, "Hey, life is happening. I know, I just want to let you know so that you don't wonder where I went," type of thing.
Mhm.
So that happens. So this person, if that was the case, you've already been in the hole $400. And now if they quit coming, the office has already been paid, and you like if that was the case, I'd be going back to them saying, "Hey, you got paid for this and this person abandoned therapy. I need my $400 back." So that's one thought. Another thought, and this is more, on our private practice, on our own business, but why wouldn't somebody take interest-free financing if it doesn't have to cost them anything? So you're going to run into that every single time, because if somebody's smart, I don't know about you, but my investments earn, on average 10%. So I keep every dime that I can. I mean, literally, my auto insurance, I will pay it for a year if there's a benefit. If not, you can get your $89 a month because I will
Mhm.
keep my money invested. So people are probably looking at that going, "Oh, free financing." It should cost them more money if they do a payment plan versus not, kind of like how we set
Mhm.
it up, that they get a 10% discount if they prepay for their therapy. What was my other thought? I had one other thought. I can't think about it. It'll come back to me, I'm sure. Um, Oh, then. So, as you've learned in the Ditch Hygiene Academy, and one of the biggest things that I take all my coaching clients through is the profit first system. So, of that 40% that you get paid, that's not all yours because you have to then pay taxes on it too. And the same
Yes.
independently, so the profit first system teaches you how you allocate money for your payment for taxes, all of that stuff. So of that 40% of that, 1600 you were supposed to get.
Mine was a big fat zero.
Yeah. So have you thought about how you are going to combat this? because literally today is the first time I've ever heard you say that they could do interest-free financing. They're financing, it's 10% and it's your 10%. So you're paying them 10% to do therapy with you.
Well, the way the practice has set it up is they take the hit for the financing, which, I mean, that's a thing. I can't change that. That's the way
Yeah.
they've structured it. So I have to kind of roll with that. But I thought this through. I was like, wait, so what's going to be my workaround? How do I avoid this? And sadly, and I spoke with the chief operating officer, trying to work this through, like explaining to her how much of a letdown and a hard hit that was for me on the front end. And they're really the way the systems are set up in the office. There's no other workaround right now unless I go session per session and the patient is paying the session at a time. And then I'm earning as I'm doing the session, which is not encouraging success if they decide, yeah, I don't feel like going
Yeah.
for that session. So
Yeah.
I don't want to do that because I feel like that's taking away from the service. But this is the reality of what it's like to be in a practice doing this. So, it made me take pause and go, I didn't expect that,
Yeah.
and I have the full support and everything surrounding me, but it's just the way the system
That
works
piece
when
of
you're
it. Yeah.
doing it for somebody else. And it's not working in your benefit. And no matter how much you try, I'm going to take the positives out of it. I'm seeing patients. I am having these great conversations. I'm building my confidence and I am learning. I'm learning as I'm going. And, that's great because this was already structured for me where here's a clientele base where when we're doing it on our own practice, it's like, okay, my website's ready. I hung my shingle. Come and get me. Here I
Is it
am.
Field of Dreams? I built it. Where are they? Yeah,
Right,
it's a little
right.
bit different of an animal. So you're
Yeah.
right. You are getting experience. It's just I can see where the frustration because my mind is already thinking, wait, we get paid up front because again, for any of you guys listening, I teach a package program and your package, like it, if somebody has an installment, so they've got four payments or whatever. If you're doing 6 months of therapy, your payment shouldn't go more than like three or four payments because you never want to be doing therapy that isn't paid for. But Michelle, I was thinking about like all your prep all like putting somebody's plan together. I charge all that stuff off at the beginning so like people know, and of course they have it in their refund policy, in their abandoned therapy policy, all that stuff that says, hey, once you commit to pay for therapy, it is all systems go. I lay out your
Mhm.
therapy, I do all of this stuff, so I put in all that work, meaning if somebody after therapy starts, there is no refund. But if for whatever reason between that first couple weeks they change their mind, they're only going to get back like a small portion because I have charged all of my time against that. So I was just
Mhm.
thinking about that for you. So you're just flying, you're just doing it for free essentially because you don't have a way to charge for that. Does that make sense?
Oh, it absolutely makes sense because there is a lot of experience, and me being the person and the provider that I am, where I'm so much into the service and the experience, they get an introductory letter. They get the supportive care. They're getting the follow-up calls. They're getting everything printed for them in a nice little folder. They get the full comprehensive report as soon as they finish the initial evaluation. Even after I'm doing the free assessment, I'm sending them a summarized, brief follow up email. There's a lot of work that's going into this because for me, it's about the experience. Now, you committed to me, I'm committed to you. I'm going to give you the best services that I have to offer. And that does take a lot of prep work.
Yeah.
You know, so I've done that for each of the patients, and it's building trust, it's building connections. And I'm hopeful that it's going to lead to more referrals, but I have to wait before I'm starting to feel the profit when it comes to having this framework within somebody else's structure. And I think that's the biggest lesson, like, hey, this is the reality of it. So if you're thinking of doing this, be mindful that you may encounter these speed bumps along the way.
Yeah. It isn't
And
so
if
much a safety net. Well, it is a safety net, but maybe not, because it's
Right.
like,
If this is
oh,
all that I'm doing, if I was only doing it there, then it's definitely not a safety net because
yeah.
that can change at any time. So, that was my biggest like, wow, okay, so my boss didn't die, but
Yeah.
this is what it looked like. I felt like that was a lot of work and building, and it's still building.
Yeah.
It's still a good thing on that end, but I'm not going to stop doing what I'm doing on my end. That's my safety net, because in the reality, when I'm doing that work, that's where I'm going to see the best turnaround for me.
For you, yeah, for your
Yeah.
for your business growth. And I guess what just popped into my mind, and you can choose, like I said, I wanted to make sure that this is not a negative conversation because we want you to remain employed because you are enjoying this work. Um, but would do you think it this is a silly question because I'm thinking, well, of course. But because oftentimes I tell women, like, build your business and let your office refer to you, just like they referred to the endodontist, just like they referred to the periodontist. So, was that ever an option for you, or they wanted it in house? Do you see what I'm asking?
I think that's where I made the mistake because I'm already in it, and I started out by, hey, did you realize that this is connected? And now we can offer more services because I
So, it
was
was your
building.
idea. It's all your fault.
It's my fault. I was building a department and trying to grow that structure and that department's profit. And, we're missing this. Let's add this on. And that's what everything was about. And
Ah.
that's where my initial training didn't prepare me for what it looks like in an office until I met you. And that's why I started skewing away from that and going, oh, I need to stop waiting for permission from them because I can do this for me. And that's where it's going to make the most sense. It just happened to be that all of a sudden they were like, no, you're right. We're on board with
Oh,
you
we're on
too.
board. Oh, now you kick yourself. That's funny because
Yes.
the wheels weren't turning that way until just at that moment because it would have been so much simpler if it is awesome. I meet so many people that do have a excellent support structure. Like
Hmm.
just get them to refer to you. Like just don't tangle, don't mix it up. But I see it. So you brought it to them. You put the feather in their hat, and then they were like,
Yes.
okay, now we want to do it. And at that point, you felt like it was going to be too hard to say, well, I've already started my own business.
But they knew I started my own business. That was part of the conversation. And I had said, like, hey, this is where I want to be. I want to be working at home remotely. I want to be able to step out of the office. And they're like, sure, if it ever builds to that, and then you are the referral system for you, great. That was initially spoken of. I don't know if that's gotten lost in the sauce
I was just going to
because
say, is that still an option? So if things go bomb diggity for you in the next couple years, you want to step out of the office, are they going to
um,
be okay to refer to you? Do you know?
I I don't. I don't know. You don't know until you have to have that conversation.
Yeah.
And you don't know what the future brings. So that's the thing that, the message, there's a lot of uncertainty when you're doing it in an office, and you can't depend on that solely. And I didn't know that. It wasn't taught to me in my first training. It wasn't brought to my attention until I did the business training with you and the done for you. And, then I realized, oh, duh. Why would I be waiting? Why? I
Yeah.
don't need to give this all to them. This is something that I can be doing on my own. So, for all those people out there that need to hear this, we're hygienists and we spend a lot of our time in a structured environment where we have rules and we can't step out of that role because that's not outside of our scope of practice. Myofunctional therapy is different. You don't have to do this under the supervision of a dentist, under the supervision of an office, or this is something that you have reciprocity. There are no limitations like the hygiene license. And I think when I started out with this, that kind of mindset was, you never have to make these decisions for yourself. You know where you're supposed to be and what you're supposed to be practicing and how within the scope of your profession. Myofunctional therapy offers you more freedom.
Oh,
And
amen.
yeah, absolutely. But I didn't realize that until I really signed up with
With this
the
fiasco.
whole program. And but it's a good, I mean, it was like, oh my gosh, well, I can't, why am I doing this here? I should have been doing this for me all
Yeah.
along.
Yeah.
Why did I wait? Nobody taught me how to do this. I could have been a year into this
You
already.
could have, but you know what? You're years ahead because I have some coaching students right now or coaching clients that I didn't train, but they were stuck, so they came to me just for the business that are years. They've wasted years, 3 years, 5 year, so you're
Yeah,
good. And I just had this revelation to me. You can fix this all, Michelle, if you just get your personal business blowing the doors off and then you'll
hmm,
just be like problem solved, like I'm going to do this full time. And if you have a good working relationship with them, which it sounds like you do, then it just naturally should become that they refer to you and you take it out into your own business. Now, two other things came to mind. Again, my business brain. If I were you at at the point now that we've had this conversation, I think that it warrants a couple more conversations, maybe in due time with whoever your boss is, going back to that whole thing. Hey, if somebody pays for a year of therapy and I've paid this fee up front and they don't finish or whatever, like once we have an abandoned therapy policy and they've kind of exceeded that, I should at least get my money back for the fee I paid, thing.
right.
And then
Uh,
thought number two, letting them know and understand, and maybe you've already done this, maybe I'm beating a dead horse, but if they know, like, hey, that just came off the top, we're offering them interest-free financing. Here's what I've learned in my business course, you know, um, because you want to sell them paid in full therapy, not interest free financing. Because and so if they understand, hey, in my class, I mean, and that's just what I do. That's what I was taught, and that's what I do. But giving somebody a 10% discount to prepay for their therapy, so it would be more financially beneficial to you if somebody just prepays their therapy, or else I wouldn't tell anybody about interest-free financing because everybody's going to take it. See what I'm saying?
yeah. The way that they've structured it and where they've chosen to be the ones to take that 10% hit on their end, and pass that on to the providers. I mean, that's not necessarily beneficial. And basically, the patients get to do the interest free financing without any sort of penalty.
Yeah.
And to
No,
me,
nobody's credit card allows that, it's
yes,
like there
yes,
needs to be some cost to the consumer for that service because
right.
they're getting to pay it and then it's coming out of your pocket. So, yeah, man, if it was me, I'm the type of person that I'd probably just be saying, I'm going to just go gangbusters and build my own thing so fast and furious so that I can leave this job and then then you can refer to me. I mean, obviously you never want to have a bad relationship with them because they sounds like they'd be a great referral source. But when it comes down to brass tacks and dollars and the bottom line, you're running a business.
Absolutely. They're a wonderful practice. I have been there for a very long time, and I have mentors in that practice that have helped me professionally and personally along the way. So, as much as I appreciate them, I do see a world where this can be a referral system. You never know what's going to happen.
Right.
And in the whole structure of today's dental practices and DSOs and things like that, you don't know what's going to happen with private practices. This is a private practice that's like a unicorn in a sea of, DSOs.
Yeah.
So you really don't know what's going to happen. But the good news is I love what I do. I love working with sleep patients, and that has led me to my niche, my person that I want to speak to in my own business. When I'm in the practice, it's full family services. So it's adults, it's children, it's a little bit of everything. I'm helping everybody, but it's very different in my private practice. I know what I don't want there. I've trying to structure along with your guidance, everything towards that. But um, you know, it has given me a lot of opportunities because every parent that I'm talking to about their child, immediately, you know what happens. They turn and they go, "Oh my God, that's what happened when I was a kid."
Mhm.
And then they realize that they also need therapy. And what does that look like? So all of these connections are leading me places, and I'm grateful and thankful for that.
Yeah.
It's just learning the different experiences and what's going to be the most beneficial for me personally in the long run, and
Yep.
that's basically it. But when you start myofunctional therapy training, nobody tells you any of this. Nobody. You're the only person. It was just like, okay, here, you're a hygienist. This is what you should be looking at. And now that you've seen it, you can help these people.
And you're like,
But
how? I don't know where to get started. I mean, that is the hill I will die on. I love the
mm,
clinical teaching. I really do because I just felt like I did a good job with it. It came easy to me. Am I perfect? No. Do I know everything? No. But the business stuff, like you guys are all, myself included. After my training, it was the same thing. Like, what do I do with this information? And I had found through my training because at the time, um, I was just a few years out of graduate school with my MBA. So there was times in my training where she would point the business questions to me. And I was
mm,
like, okay, well, this seems weird. You're the pro, but then I found afterwards, like, it's such a missing piece of the puzzle. Now, I do have to say one thing, just because you were talking about your niche, and I thought about it earlier, and I was like, oh, I got to tell her this. So, remember back, an hour ago when you were saying how you were stalking me, you know where I'm going with this? You were stalking me and you were taking in all my free content, and you were just like, she's my person. I know her. That's your who. That is
hmm
your who. That is the feeling like how I had another one today. I come back from lunch and there's an application to join my coaching. Like I've never met her. So that is the feeling. You want that person to see and feel seen, but when you said that,
yeah,
I was like, oh yeah. And I'm arguing with Michelle about her niche. Like, no, that's what you want them to say is like, I just had a connection with you and your personality that like people have a hard
yeah,
time believing that anybody would wait on a wait list to work with me. And that's because they have that connection. So that's what you're looking for, your adults, whether it's men or women or whatever, as you're working on that feeling. Because that tells you like, oh, that is my Lola. So I love that. I love
yes.
that. Well, I want to be respectful of your time. So I have one last question. What would you say? You've given a ton of gold in this podcast, but what would you say to actually maybe two questions. What would you say to the woman who is not trained yet, but is considering courses? Like, how do you pick one? Number two, what would you say to the one who's trained and trying to build it in her office? Those are leading questions, my friend.
Um, okay, so I immediately knew that I wanted to do the training on my own and pay for my own training. And at one point, my boss, he did offer to pay for my training, and I declined because I knew this was me. This was for me, this was for my business. So I would advise anybody to make the investment for yourself and don't let somebody invest for you, because then there's a feeling of ownership there, and
And you
there's
owe them
ownership
something. Yeah.
and control, and this should be your freedom, this should be your out. I would not necessarily structure it within a dental practice. It's a great referral source, and maybe you go in, and if they need somebody to be live, do a comprehensive exam there, and then therapy outside at home, or find some sort of a hybrid, but keep it mostly to your business. When you start building in an office, there are rules, there are things that you have to abide by. You don't have that same sense of freedom of setting it up the way you see it
For your
to
business.
need to happen for your patient, for your business. So that would be my advice. And if you're choosing courses, go with Carmen's course. I mean, it's just like a no-brainer, just
Well,
hands down, because the course I took was great, but it was really basic information. And I do still have a study group and things connected to that. So, I'm seeing the questions and things that come up. And now, having gone through your course and having the ditch hygiene with the done for you business part of it, now when I look at those questions, I think, oh my God, that's so basic. They should know the answer to this
mhm,
question, and not now they're done with their training asking in the group, hey, does anybody know what to do with this?
they
Where
should know it. Yeah.
you should know it. And that's something that was you investing in the course that I took with you. That was something that was
Yeah.
given to me.
Yeah.
And
Thank you for that. I received that. I
mhm.
love that. It's such a, I mean, anybody can talk about how, I mean, we all like, hey, mine's better than yours, and here's why. But at the end of the day, what's out there and practicing is very important to deliver for our clients. That is the
Mhm.
biggest thing. And like when you say they should know the answer to that, that's not, because I say that sometimes and I get after myself, like, am I just being like little Miss Bossy Pants who thinks she's just all that in a bag of chips? No, they should know that. They should
I
know that.
didn't,
Yeah.
you know, where I was with them, I didn't know that. And now I'm thinking, oh my gosh, I'm glad I kept looking,
Yeah.
because that's where I was. I didn't know the answer. And now I go, that's pretty basic. You really
That's
should
pretty
know that.
basic. Yeah. Yeah.
Yeah.
No, I really appreciate that. And the thing I appreciate from you, and I think is a great message to other people out there considering this, is do not be afraid to invest in yourself. So you talked about like, is it worth it? No, are you worth it? Because I know that I'm going to deliver, but it's scary. And I think a lot of women are afraid to invest because they also know that they're going to flake. They're not going to do the work. They're not going to do all the things that you have done. Like you've been like a robot, step by step. Do this, do this, do this, do this. But at the end of the day, if you take a course and it doesn't deliver what you need to get started, you have two options. You can sit with that material and let it sit there and rot, which that would have drove me crazy because
Mhm.
I was so in love with myofunctional therapy that I could not imagine having that knowledge and not using it. And if your program didn't work, you got to find another one that'll bring everything together for you. So I am super proud of how far you've come, and I can't wait to see you. I want to see you build your thing so that this thing, your the in office stuff,
You know, in a
is
perfect world, they would both grow and flourish and balance each other nicely. If you're doing it in an office, it's going to take you longer to receive the profits on that end than it does in your own practice. And that's what
yeah.
I'm coming to learn. And as far as the investment, it's a scary thing to think to invest thousands because it's a lot. And, you know, I'm going to share with you my decision was to borrow against my 401k plan and take a loan against my 401k plan and pay myself back.
Yep.
And it worked. You know,
Yep.
I took a startup fund out of there. And, you know, that's a scary thing when you make a decision like that.
Mhm.
And anything that's that much money is always, you know, going to give anybody pause.
Yeah.
But I
But if
have
you
no
do the
regrets.
work, you do, I mean, like you have got the skills, you've got the you've got all the stuff. Now,
Hmm.
just like you and I were talking today, okay, now the marketing stuff. So it
Yep.
just it's one foot in front of the other. So I appreciate you. I so appreciate you coming on here. There is somebody listening to this or who will listen to this that it's going to be what pushes them off the fence of like, nope, I'm not doing that. I know they're nervous. They don't want to, do it on their own. They want to do it in the practice. There's just so many things. And it just, you absolutely are having the best attitude of like, okay, but I didn't know it was your fault until today.
Yes, it was my fault. I started the whole thing and I put myself in this situation and I'm going to follow through with what I commit to.
Yeah.
I'm going to say that this has been a learning process. And sometimes you say it, people's feelings are going to get hurt. And so on the front end, a little bit of my feelings when I got that big fat zero initial
Yeah, I
paycheck.
remember how
So,
you were just like, oh gosh. So, and
yes,
that's hard. So, all right, my friend,
thank you
let's
so much.
land this plane.
Mhm.
Thank you so much. I so appreciate you.